I'm Michel Cormier in Changchun, China, with the story of a Canadian surgeon who's literally following in the footsteps of Dr. Norman Bethune.
In English, it's called the serratus. Anterior serratus muscle.
For a year now, Dr. Jean Deslauriers has been living in China, teaching doctors to operate on patients with lung cancer. Like Norman Bethune, he is a thoracic surgeon, and like Bethune, he was lured to China because of the crying health needs of its people. He feels an affinity for Bethune, who left the teaching position at McGill to become a hero of the Chinese Revolution.
And Bethune, what he did, he emphasized that patients should be treated by teams of doctors, not one doctor. And I'm trying to do the same thing. Try to create a multidisciplinary spirit, a team spirit, which they didn't have. And continue chemotherapy and radiation after.
Dr. Deslauriers is a renowned surgeon from Laval University in Quebec City. He's written textbooks that are used around the world. The staff here calls him Grandpa Jean.
Some people think that way. Kevin doesn't think that way, and he can argue with me.
He is a tough teacher, but they respect him.
He's a pretty good teacher, and we like him very much.
I'm honored to be giving this lecture.
In his many trips to China, Dr. Deslauriers has also become somewhat of an expert on Norman Bethune. He even gives lectures on the famous doctor who's still a household name in China.
Even when he was on the battlefield, he would take young boys, teach them the basics of military medicine, wound care, infections, how to fix fractures.
Healthcare in China today, however, is totally different from what Bethune fought and died for, free medicine for people. The Jilin University Hospital, which was founded in his memory and where Dr. Deslauriers teaches, is a private hospital. It has medical equipment many Canadian hospitals can't afford, but the patient has to pay for everything. Many patients like Ni Yu Day come to the Jilin hospitals because local doctors can't do anything for them. He has lung cancer. The operation here will cost $17,000. His wife, Sun Changrong, says they will have to decide whether they sell the farm to pay for it. Dr. Deslauriers says it breaks his heart to know that many of the patients he sees will not get treated.
The fact that one patient cannot be treated because he has no money, that is a big problem for me personally as a Canadian. I've never seen that before, so I don't understand that. But there's nothing I can do about it. Okay, so Dr. Zhang, the patient is a...
Well, he is trying to do something about it. He's trying to set up a foundation that would raise money to pay for operations for people who can't afford them. A lone Canadian trying to promote the values of socialized medicine in the new capitalist China. Michel Cormier, CBC News, Jilin.